Hello dear students, I'm Zubair Ahmed. Today I have uploaded Fundamental of Nursing MCQ. I hope everyone listened carefully.
Infected bandage discard in which bag? A. Yellow. B. Red. C. Blue. D. Black. Correct answer. Yellow bag. All dressings, bandages and cotton swabs with body fluids, blood bags, human anatomical waste, body parts are to be discarded in yellow bags. Triage means A. Large. B. Emergency. C. Sort. D. None above. Correct answer. Triage is a process of sorting patients based on their need for emergency treatment. It is used when there are more patients than available resources, and it helps to ensure that the most urgent cases are treated first. Which position given to patient in sigmoidoscopy? A. Prone. B. Supine. C. Lithotomy. D. Knee chest. Correct answer. Sigmoidoscopy is the minimally invasive medical examination of the large intestine from the rectum through the nearest part of the colon, the sigmoid colon. There are two types of sigmoidoscopy: flexible sigmoidoscopy, which uses a flexible endoscope, and rigid sigmoidoscopy, which uses a rigid device. The choice of TURP transurethral resection solution for irrigation time. A. Normal saline. B. Plain water. C. Glycerol. D. None above. Correct answer. Transurethral resection of the prostate TURP typically utilizes large volumes of irrigation fluids for distension and irrigation during the procedure. Historically, these fluids were slightly hyposmolar solutions of glycine, sorbitol, or glucose. When cleaning the eyelids, the nurse should clean from the A. Inner canthus to outer canthus. B. Outer canthus to inner canthus. C. Medial to inner canthus. D. Outer to medial. Correct answer. When cleaning the eyelids, the nurse should clean from the inner canthus toward the outer canthus so as not to introduce debris or dirt into the lacrimal ducts that could cause an infection. Decannulization means A. IV cannula removal. B. IV cannula insertion. C. Tracheostomy removal. D. Tracheostomy. No. Correct answer is circa. Tracheostomy decannulation is the process of removing your child's tracheostomy tube. A head injury patient. Which alarming event soft surface show ill patients? A. Tachycardia. B. Hypotension. C. Hypoglycemia. D. Ear bleeding. Correct answer. Ear bleeding is a sign of a basilar skull fracture, which is a serious type of head injury. Basilar skull fractures occur when the bone at the base of the skull is fractured. This can happen as a result of a fall, a car accident, or other type of head trauma. A nurse would assess that a patient is experiencing Chine-Stokes respiration when he has A. Period of hyperpnea alternating with period of apnea. B. Period of tachypnea alternating with period of apnea. C. An increase in both rate and depth of respirations. D. None of these. Correct answer. Chine-Stokes respiration is characterized by a pattern of progressively deeper and sometimes faster breathing, hyperpnea, followed by a gradual decrease that results in a temporary stop in breathing, apnea. This pattern often repeats in cycles. Objective data collection method accept. A. Group discussion. B. Panel diffusion. C. Demonstration. D. Interview. Correct answer. Objective data collection methods are focused on gathering factual information that is observable, measurable, and independent of the individual's interpretation. Interviews, on the other hand, are a subjective data collection method that involves direct interaction and conversation between the interviewer and interviewee. Ringer and Hash-039, S-lactate intravenous infusion solution does not contain which of the following? A. Sodium. B. Potassium. C. Chloride. D. Bicarbonate. Correct answer. Ringer's lactate solution is a type of isotonic crystalloid fluid. It is used to replace fluids and electrolytes in those who have low blood volume or low blood pressure. It may also be used to treat metabolic acidosis and to wash the eye following a chemical burn. It is given by intravenous infusion or applied to the affected area. The first step of planning process is A. Formation of objective. B. Forecasting. C. Deciding the plan of action. D. Time scheduling. Correct answer. The first step of the planning process is formation of objectives. Objectives are the specific and measurable outcomes that an organization aims to achieve within a given time frame. These objectives provide direction and purpose for the planning process, as well as a basis for evaluating the success of the plan. Once objectives have been established, the planning process can proceed with other steps such as forecasting, deciding the plan of action, and time scheduling. Records and reports are maintained as A. Assess the treatment needs. B. Improve patient care. C. Avoid duplication of efforts. D. Avoid audit objection. Correct answer. What should be the temperature of water used for tepid sponge? A. 98 and deg, F. B. 105 and deg, F. C. 80 to 90 and deg, F. D. 0 and deg, F. Correct answer. Tepid sponge is a process of sponging with tepid water to reduce body temperature by evaporation. The temperature of water used for tepid sponge is 80 to 90 degree F. The normal blood pressure of an adult is A. 120/80ths. B. 120/100ths. C. 150/100ths. D. 150/60ths. Correct answer. Angiography is X-ray visualization of A. Lungs. B. Blood cloth. C. Blood vessels. D. Heart.
Please answer me in the comment box.